Hello, I am Dr. Lisa Koch, and it is a pleasure to have you in this class. In this presentation, I wish to demonstrate a few of the exercises that are used in vestibular rehabilitation therapy. These exercises are referred to in the vestibular exercises page in your course content. I will not demonstrate all of these exercises, just some that I use most often. First, you have the patient sit in a chair to do these exercises. Of course, the patient's safety is our chief concern while they're doing these exercises, and we do not want to put the patient at increased risk of falling. The patient will need two playing cards ready to use, either two playing cards or two index cards. The purpose of these cards is to give the patient something to focus on while doing these exercises. If their eyes are wandering, the exercises will produce little benefit. The first few exercises are adaptation exercises. The first exercise I want to demonstrate are head circles. The patient rotates their head 360 degrees. First in one direction with their eyes open, and then in the other direction, again with their eyes open, and then the patient completes the exercise with their eyes closed, first in one direction and then in the other direction. About 10 repetitions in each direction is suggested. Visual tracking is a good adaptation exercise. The patient holds one card. They hold the card. It's important to hold it up to eye level and at approximately arm's length. Many times I have the patient, if their arms become tired, either tape their card to a wall, or as long as they can sit and the card is approximately arm length, they don't have to hold the card. They can tape it, for example, to a wall, or with a magnet put it on their refrigerator. Visual tracking, the patient holds the card and the head is maintained center while the card is moved back and forth, and the eyes always maintain focus on the card, so the card must be in the patient's field of vision. Okay. Focus with head turn is done again by having the patient hold a card. However, this time the card remains still. The head is moved first in one direction, then the other, while constantly keeping the eyes focused on the card. Okay. For target exercises, the patient is asked to select an object, one 90 degrees to the right and the other 90 degrees to the left. For example, a lamp on the left and maybe a picture on the right. And the patient then, while they're sitting in their chair, looks first at one object, then quickly over to the other side, to the other object, and then they stop in the midline and repeat this exercise, first one side to the other, then center. Repeat that approximately 10 times. And then you can have the patient begin on the opposite side first, then the other, and then back to midline. Head movement exercises are completed in a similar way. First, looking to one side and center, then to the other side, then back to midline. One way to make these exercises more difficult is to do them at faster speeds. And all of these exercises can be done horizontally as well as vertically, depending on your patient's needs. The patient, as the difficulty of the exercises increases, can also do them while standing or walking. Saccade exercise is the last one that I want to demonstrate. The patient needs both cards, and they hold one card approximately 30 degrees to the left, and the other card approximately 30 degrees to the right. The patient then looks first to one card and then to the other, and back and forth. And maybe 25 repetitions of this one.